Oh, that's not good. Okay, that's better. So welcome everybody. This is Jeremy Grimshaw. We're still getting people joining the webinar, so we'll give it another couple of minutes and then we'll start. But thanks for joining us today. And you can see that. Okay, I'm going to give it one more minute and then we'll start. We've had a few technical glitches in terms of people being able to log on, so hopefully we'll be or people will be finding their way into the room. Okay, let's start. So my name is Jeremy Grimshaw. I'm a senior scientist and at the Ottawa Hospital Research Institute and Professor of Medicine at the University of Ottawa. And I'd like to welcome you to, this is the third of the BESI webinar series. And before we get on with the business of the day, I'm just going to sort of basically give a bit of background in terms of what BESI is about. So BESI refers to behavioural, environmental, social and system interventions. And the reason that we're interested in this is that while we wait for a vaccine, our only means of controlling COVID-19 is through these BESI interventions. And you know, arguably what's been remarkable in the last, 8 months, has been how well these BESI interventions have actually been able to flatten the wave. Clearly, many countries are now going through a second or third wave, and there are ongoing challenges about ensuring that that people fully use BESI interventions. But even when we get a vaccine, the uptake of the vaccine and its effectiveness will depend on people's behaviours, whether they actually go and get a vaccine or not. But when we look at the research environment from our perspective, and we'll hear more from people involved in the funding environment today, the investment in research on how to optimize BESI interventions has been a tiny fraction of those spent on pharmacological interventions. And so we felt that we needed to bring together a coalition of researchers, decision makers, implementers, and funders to help address this this imbalance. So actually, this was actually published in the Irish Times today by one of our previous speakers, Molly Byrne. But as usual, the headline writers have probably got it right. Behaviour is the best COVID-19 vaccine available, and we need to find ways in which societies can support citizens to enact the best behaviours to prevent transmission. So BESI is a global initiative, and it was started by Paul Glasziou and Susan Mickey and myself. And the primary objective of BESI is to reduce viral transmission to achieve zero COVID-19 by behavioural, environmental, social and system interventions with maximum effect and minimal disruption. But we also think there's a longer term objective, which is to help us reduce the likelihood and impact of future pandemics and also to build back better. BESI is global, interdisciplinary, and based on the translation of evidence into policy and practice. Within BESI, we feel that we need to bring together health organizations, national and local governments, community organizations and leaders, industry and NGOs, with an interdisciplinary research collaborative network that will undertake rapid evidence syntheses to understand what the current state of the evidence is. Based on that, identify priorities for future research that we envisage will then involve developing using co-design and user-centered design principles and pilot testing of possible BESI interventions, leading to field trials and they will feed back into evidence syntheses to support decision makers globally as they think about how their societies can support individuals. So this is the third webinar in our series. Just a few sort of process measures, factors. Can you please try and use a question and answer to type in questions rather than the chat box? That helps us in terms of managing this as we go through. You can do this at any time, so you can do it while I'm talking or while the speakers are talking, and we'll make sure we get back to you. If you do use a discussion, a question and answer, please add your name and country. It's really helpful to know who's asking the question, where you're from. And remember that you can follow at Betty Collab on Twitter. And also, if you want to tweet, please do. You can tweet using the hashtag #BessyTalk. So delighted to welcome you to the third webinar. The first two, one was a general introduction to the need for BESI type research. Last time we talked about the policy environment and how research can play into that to support societies. This time we're going to talk about another piece in the puzzle, which is funding for COVID research. You know, what's currently happening, what's likely to happen in the future, and we have three great speakers from representing a diverse range of perspectives. And I'm going to hand over to my colleague Susan Mickey in a minute, and she will introduce them. This is just to let you know that there will be further webinars, and these are the details when we put this up at the end of the webinar, this webinar, so you can see it. But the next one is at Tuesday, the 10th of November. So please make sure that you put that in your diary and hold the date. So I'm now going to hand over to my colleague Susan Mickey, and she will introduce our speakers. So Susan, over to you.
Thank you very much, and welcome from me also to this webinar. And delighted we have three excellent speakers today. And the very first one is Marisa Creatori. And Dr. Creatori is Associate Scientific Director at the Canadian Institutes of Health Research in the Institute of Population and Public Health there. She's also an Associate Professor of Epidemiology at the University of Toronto. And today she's going to present to us a very exciting development, the United Nations Research Roadmap for the COVID-19 recovery. And I gather that we are the first audience to be privileged to hear this. So Marisa, warm welcome, and over to you.
Thank you very much, Susan, and thank you, Paul and Jeremy, for the invitation. I'm just going to pull up my slides, and hopefully all will go smoothly in terms of sharing. There we go. Are you able to see, is it on presentation mode?
Correct? Yes, that's good.
Yep.
So good morning once again. Thank you for having me this morning. I'm speaking to you from Toronto, where the sun hasn't actually yet come up. So we might see some sun coming through my window shortly. Thank you for the introduction, Susan. As you mentioned, I'm from the Canadian Institutes for Health Research, and for those who aren't familiar with it, we are Canada's federal funding agency for health research. And in my 5 minutes this morning, I'm quite delighted to be presenting to you about some work that we undertook on behalf of the United Nations to develop a research roadmap for COVID-19 recovery, as Susan mentioned. And this roadmap has not yet been published. So we are expecting it to be published imminently, as early perhaps as later this week. Whoops. All right, so how do I do the next slide? Sorry.
If you go to the bottom left-hand side of your screen, Marisa, there's a little...
Thank you, brilliant. All right, so I think, Jeremy, you've sort of mentioned quite a bit of this, that in the early days, as we know, most of the COVID-related research that was being funded was really more on the biomedical side. But as we all know, who are participating today, of course, COVID-19 has had many far-reaching consequences, and it's not just a biological phenomenon, but a very strong social phenomenon, affecting almost all sectors of society, and particularly, unfortunately, of course, impacting the most vulnerable populations. and further putting a spotlight on many unsustainable practices. So one of the issues that we've been focusing on in the work that we did for the UN roadmap was looking at the non-health impacts and how we can stimulate and catalyze additional research in these non-health impacts to COVID, specifically in the hope of achieving the Sustainable Development Goals by the 2030 aim. So a little bit of background of where this report came from. In April, the United Nations Development System published a framework for the immediate socioeconomic response to COVID-19. And this, in turn, was a response to the UN Secretary General call to action in support of an integrated, coordinated global response to the pandemic. In this framework, which provided a strategy for the socioeconomic recovery from the pandemic, it focused on key actions across 5 critical pillars that are presented here on the slide. So health services and systems, social protection and basic services, economic response and recovery, macroeconomic response and multilateral collaboration, and social cohesion and community resilience. While working towards the societal recovery from COVID will provide us ultimately an opportunity for the transformative changes needed to achieve a better future envisioned by the SDGs, we're basically coming to a point where we need to make a choice, business as usual or embracing some transformative changes. The issue, of course, which is where the roadmap comes in, is that although we have a vision for where we want to end up, and the SDGs lay out much of this vision, we actually don't have the answers around how to achieve this future and how to ensure that we don't just fall back into the business as usual status quo. So this, of course, is where the research roadmap comes in. And just due to similar work that we were doing, and Dr. Stephen Hoffman, who is the a scientific director of our institute, the United Nations approached us to lead a 10-week process to develop this research roadmap for COVID-19 recovery. So what did we do? We undertook, as I mentioned, in 10 weeks, an intensive process engaging with hundreds of people from all over the world to collaborate with us to identify key knowledge gaps that will help us to recover better from COVID, structured around the 5 pillars that I identified on an earlier slide. We struck 5 steering groups. So again, in this time, it was a short time period, but we struck 5 steering groups. We commissioned 5 scoping reviews, 1 for each pillar, and we conducted key informant interviews, surveys, and virtual consultations. Following widespread engagement with researchers, research funders, government policymakers, civil society leaders, and the UN officials around the world, we collated this information and pulled together the research roadmap. And of course, I do want to mention that in all these consultations, we made a very strong effort to make sure we had balance of voices from the global north and the global south. So this 10-week process resulted at the end of the day in 25 high-level research priorities that all help to ensure, or not to ensure, but all help to support addressing an answer or finding an answer to a singularly important question, which was, how can COVID-19 socioeconomic recovery efforts be purposefully designed to stimulate equity, resilience, sustainability, and progress towards the SDGs? So of course, I can't, in my 5 minutes, I'm not going to present these questions or the report, but essentially these 25 high-level questions were then further broken down to examine more specific pressing questions, considering issues such as temporal urgency, the cost, north-south contexts and priorities, and then of course, long-term transformative impacts and goals. This is just an example of what you would see in the report as one of the pages. And I would encourage you, hopefully in the next week or so, that you'll be able to go online and look at it yourselves. So further to these questions, obviously there were, these guiding, the ultimate question that we were trying to answer, the sort of 25 priority areas, and then sort of broken out into sort of more specific questions. There were also some other insights that that we obtained through the process of these consultations and scoping reviews. And one is that, of course, there are questions that need answering, but research and the solutions that that research supports really needs to be cultivated within a broader research ecosystem. And there are some learnings that that we have and knowledge gaps in terms of even structuring and organizing and delivering on that research ecosystem. And some of those 5 important insights are presented here as sort of science strategies that are necessary for those recovery priorities to be acted upon. So one is, of course, around data. COVID has highlighted the need for data and close to real-time data analysis. So this is, of course, an important area for us to continue to invest in. We found that one of the things that we heard was that we really need to have more implementation science. And that, of course, means that we need to fund more implementation science. We need to ensure that we are building and supporting rapid learning systems so that this is sort of really an iterative process, not unidirectional, but really constantly learning from what works and what doesn't work. Of course, as everybody on this call knows as well, we need to strengthen knowledge mobilization. It's not just about conducting the research, but actually promoting the use of research evidence. And how can we train researchers to do this better? There's still a gap in training of researchers in this space. And then, of course, the building the science of science. And when we talk about the science of science, we're really focusing on, how research is funded, practiced, and evaluated. This includes promoting open science, inclusive science, focus on equity, and how to maximize impact as well. So, of course, this is, we are, CIHR is a research funder, and of course, we have a particular perspective, but really the roadmap is really outlining multiple different roles that, that need to be taken up. And this is, of course, for researchers as well, who are going to be doing the actual research, for those of us who are funding it, but then also of government and civil society organizations that need to be really part of asking the questions and really focusing on what's needed to inform recovery efforts. And finally, hopefully I stuck to my 5 minutes. Finally, the report is not, it's really meant to be a green document. It's not meant to provide all the answers, or in this case, all the questions that need to be answered. But really, we used a highly participatory process to try to provide some basic structure and tools to get us, as this slide shows, to really get us rowing all in the same direction. And I really hope that one of the big goals of this report is really to stimulate discussion and to have open dialogue around how we can move forward together. So once again, thank you very much. I will stop and pass back on to the moderators.
Marissa, thank you. That's incredibly exciting. I mean, both the process of how that was done, but also what's come up from it. Before we move on, just to make a couple of comments to get people thinking, because there's no questions in the Q&A section yet. I was trying to think about how BESI fits in to what you were saying. I think there's 2 very obvious areas. One is in the recovery, the resilience part of recovery. So I think this is where behavioral, environmental, social, and systems are going to be absolutely key to that. And the other, I mean, the scientific strategy and how it's presented, I thought was brilliant, really great, and loved the science of science concept right in the middle there. Being how research is funded, practiced, and evaluated. And I think that's very much what we're feeding into, that aspect of what is the focus of the science here. So a great introduction to this session. And I'd like to now move on to our second speaker, who I have known personally for many years and a great supporter of BESI before BESI had been conceived, Dr. João Rangel de Almeida, who's Portfolio Development Manager at the Wellcome Trust UK. And this focuses on medical humanities and social sciences. And he's also vice chair of Glopidar, and João will tell us what Glopidar is. He's vice chair of the social science working group of Glopidar, I should say. And today we'll present the aims and activities of Glopidar, which I think has got a very important contribution to play in this area. So João, over to you. Thank you.
Thank you so much, Susan. Yeah, today, I think I'll spend the next 5 minutes building on what Marisa presented, or better, the work that Marisa and her team have been conducting has been possible through many years of collaboration among funders. And I think if there's a key takeaway for today's talk is that funding is a complex activity, and like in geopolitical affairs, cooperation and collaboration tends to benefit the common goal. And the common goal here is the health of people, researchers, knowledge users, and also the funders community. And I'll be focusing 3 things. First, I'll be looking at a brief overview of typologies of funding. Second, I'll be looking at the work that Wellcome in particular did around Zika in 2015-2016, and then I will shift gears to COVID-19. So 5 minutes, 3 points, it should be sweet. So starting with the typologies of funding. Funders are a very heterogeneous community, and we all have our peculiarities. Some fund in a direct mode, so funders will go after the research community with research problems and make those funding decisions. Others fund in response mode. So we'll have set schemes and wait for proposals and make our decisions. Some funders are strictly focused, like Wellcome, on health affairs. Other funders are broad in their focus, like typically government funding bodies. Some have a national focus, others a global focus. Some are able to make decisions very fast. Others take a slow mode of decision making. And the ecosystem is very mixed, and there's no right answer. Right? The fact that Wellcome can fund within 24 hours of a health emergency, and CHR can make decisions within 1 to 3 months, it does not mean that Wellcome is better than CHR. It just acknowledges the complexity of funding making. And traditionally, the funding community tends to spend more time making awards than managing the portfolios. And I think that is an important point. There is a tendency, or a tendency in the last years, to move away from that work mode and to be more engaged with the management of the active portfolio. But that comes with additional challenges and additional costs. So it's a quite complex ecosystem. And in the past, we saw that instead of building in the diversity of each other's capacities, funders work in isolation. And I think Zika is a good example of it. And it was just in 2015, and now with COVID, it seems so far away. But a health emergency, a global health emergency that had to deal with a disease that no one was expecting. All the suddenly reports of children being born with microcephaly in Brazil started arriving, and no one knew what was happening. I will just look at what Wellcome did at that time, and that was, first of all, working in collaboration with UK Medical Research Council and with DFID. These collaborations, I should say, they were informal collaborations. It meant that the 3 funders met on a weekly basis and set a funding decision in an informal way. What about the other funders? we had no idea. Not because we were not interested in what other funders were doing, but communication and collaboration as costs in themselves. And when responding to an emergency, the balance of setting up new structures to collaborate and to coordinate, or using the status quo to make efficient decisions, it's always a difficult decision. At Wellcome, we also established the channels of communication with several what I'll call knowledge users, being the UK government, being the World Health Organization, or in the case of Zika, the Brazilian government. So Wellcome was one more funder that these stakeholders would have to engage among a constellation of funders, a very inefficient way of working, also very untransparent. We never knew what these stakeholders were saying to each other, so coordination was problematic. In the midst of all these, Wellcome ended up with an amazing portfolio, I should say. And, just 3 quick examples. We had Deborah Diniz, an anthropologist in Brazil, documenting the life of mothers caring for children with Zika. Laura Rodriguez at the London School of Hygiene and Tropical Medicine, conducting cohort studies looking at the impact of microcephaly in the development of the babies. Or Stephen Sinkins in Glasgow, looking at the use of Wolbachia, a bacteria, to infect mosquitoes as a way of controlling the spread of the disease. So despite the quality and the excitement of the portfolio worked in isolation. And that was not just Wellcome noticing this isolation and thinking that that there should be better ways of working. And we see that in the cusp of Zika, 2 major organizations are built. At WHO, the Blueprint team is created in May 2016. And the Blueprint team was designed to fast-track the availability of effective tests, vaccines, and medicines to create a priority of pathogens that the research community could focus their attention, and also the funders community could focus their attentions. So the team created clear plans for the development of therapeutics, vaccines, and drugs. And those plans included also mechanisms to bring those technologies to markets, which means taking consideration legal issues, ethical issues, but also engagement with communities. So we start seeing this mechanism emerging for coordination of research activities, and a paradigm shift of thinking that together we can do better than a fragmented approach. From the funders' perspective, we also saw the emergence of GloPIDA. And GloPIDA was created a bit early in 2013, but its activities were never very present. But in January 2015, the European Commission made a grant to GloPIDA to create and fund a secretariat, and things started changing. So GloPIDA became a forum where funders could come together and think, given the complexity of funding, given that the innate characteristics of all our funding activity, how could we build on that? So going back to my example of Wellcome being able to fund in 24 hours and CHI in 2 or 3 months, how can we create a program activities where we address the immediate priorities through Wellcome, and then second activities through other funders? And that was extremely useful to create trust and to create channels of communication. But GloPIDA also attempted to have a more ambitious activity. So we created working groups that go from specific diseases to data sharing or social sciences. We knew that social sciences were not yet fully integrated in organizations like WHO, like UNICEF, but also like many national governments. And we wanted as funders to create a space where we could create a program that will build towards that integration. And so we did. And now coming to COVID-19, we see a very different world, maybe even a revolution in funding activities. So the first reports and official reports of something happening started in late December 2019, and very quickly GloPIDA and WHO came together, recognizing that we needed a research agenda to act efficient, to act quickly. And in February, a coordination meeting was organized, still in Geneva, when we could all travel to meetings. That was a meeting with around 200 people, and it was broken into working groups that are still active, one of them being social sciences, another one ethics, but you have for vaccines and so on. And the idea was to create mechanisms to accelerate research, set priorities, but also to set funding mechanisms and to maintain a funding track mechanisms to make sure that we are delivering on those priorities. So based on that meeting, again, where WHO and the funders communities came together, funders were able to make multiple calls or multiple funding actions, and were able also to prioritize and make clear and transparent funding decisions. Our decisions were based on the priorities set by WHO and GloPIDA. Later on, now in July, GloPIDA organized a research synergy, acknowledged that by bringing the portfolios of all members, we could create again communities, share knowledge, and support the development of new researchers or of new research. So in July, we saw that that meeting that allow researchers to update on their work. So this very quick overview, I think my 5 minutes are coming to an end, just highlights the complexity of making funding decisions and running these machineries, but also the opportunities that collaboration and cooperation bring. And I think the roadmap that Marisa just presented is one of the things that can emerge now, still in a complex environment, but brings funders together to deliver for the common good. And I'll finish here. Thank you.
Thank you very much, Jai. That was really interesting and important contribution. And in introducing you and GloPIDA, I should have said what GloPIDA stands for, which is Global Research Collaboration for Infectious Disease Preparedness. And before we move on, again, there's no questions in the Q&A function yet. I hope it is working. So encourage people to put questions as we go on, if nothing else, to show that this facility is working. But I'd like to just sort of raise a couple of issues. I suppose one is, how do we think about preparedness? Because, you know, what Bessie has been, as Jeremy outlined in the introduction, really focused on is reducing transmission. And, you know, how big is preparedness, and does preparedness take into account the interventions to reduce transmission? And the other thing about Bessie, you know, we have behavioral, but we also have environmental interventions. So, you know, all sorts of things to do with, for example, ventilation, or using copper on surfaces that are very much using the environment, and how the kind of very cross-disciplinary, cross-sector sort of idea of Bessie fits in with GloPIDA, where you've got a social science bit, and then you've got other bits, and what we're talking about really cuts across all of those different sections. So if you, before we move on to Michael, if you're able to address those now while people are thinking of other questions, that'd be great. You're muted, Jai.
I'll start with the first question on preparedness. And preparedness is something that, as a current program, we see emerging in maybe the last decade, and especially at the level of the World Health Organization, talking about epidemic preparedness. And unsurprisingly, that preparedness was initially focused on the development of technology solutions or technological solutions, being vaccines, being diagnostic tools, or being new drugs. I start seeing a shift in that approach because that preparedness did not yield the fruits that promised to yield. So WHO has just created a new director for community resilience. And as those plans are still very much in development, it signals a change that we can have all the technocratic solutions if we don't engage with social context, if we don't engage with communities, we will not be able to be prepared, whatever that preparedness is. I think it also raises important discussions about what is this context of preparedness. What models of society are we envisioning for the future? And also, who designs those models of society? Should we, this group, be in charge of developing those modes of societies, those visions for the future for Sudan, for Brazil, or are there different modes of bringing different voices? Again, it's this issue of community engagement and resilience, but it's not easy. If it was easy, we would be in a very different world. So I think there's a positive shift towards that space. Where are we going? It's still not clear, but I hope that Bessie and the research community will be able to navigate around those murky waters.
Great, thank you. And I'm delighted that we do have a question and comment. So I know that the facility is working. So thank you, the first person who has put a question or comment in there, and encourage others to do. Also, as you listen to our third speaker, Dr. Michael Head, delighted to welcome you, Michael. Dr. Head is Senior Research Fellow at the University of Southampton in the UK, and he's going to discuss the research spend on COVID-19, identifying research strengths, knowledge gaps, and future priorities. Thank you, Michael.
Thank you, Susan. Good morning, afternoon, evening, everybody, depending on which part of the globe you are in. I should just put my slides on the screen. Hopefully you can now see them in presentation format.
Yep.
So yes, I'm based in the Clinical Informatics Research Unit at University of Southampton. I won't dwell on this slide, but there's a few groups within our unit which cover things like health policy, governance, data science, informatics. My unit within that is RESIN, which is the Research Investments in Global Health Study. And this is a long-running project that I've been playing about with for over a decade now, looking at how best to analyse funding trends in health research, particularly around infectious diseases, which is my background area. Our most recent output covers an analysis of $105 billion worth of research funding for infection over an 18-year time period, which came from public and charitable funders. That is the article there in Lancet Global Health, which was published earlier this month. We're still in October, yes, earlier this month. So you can wander off and have a look at that if you are so interested. But this is one of the sort of summary aspects of this of this data set, $105 billion, and you can see that roughly since about 2006 or so, funding has been declining for infectious disease research. In itself, that's kind of fair enough because the burden of infection is going down whilst the burden of non-communicable diseases is most certainly rising. But obviously within that, there's not been too much prior attention by the global health community looking at pandemic planning or outbreaks of infectious diseases. And we can demonstrate that a little bit more by looking at the bugs themselves. So we categorize each individual award within our $105 billion data set, about 94,000 projects in there. And about 0.4% of the funding spent on coronaviruses. And you can see that the funding itself is very much attached to when public health emergencies and outbreaks happen. So the first SARS outbreak back in 2004 and then MERS 2015. Funding available at the time, not a lot before or afterwards. And you can see also with Ebola, around 1% of the overall data set spent on Ebola virus research, with it overwhelmingly focused on the, at the time of the West Africa outbreak a few years back. And we can also show the same with Zika as well. Again, overwhelmingly the funding was kind of devoted to when the outbreak happened in South America rather than beforehand. Certainly Zika was a bit of an unknown virus. Even those of us working in infectious disease research were often Googling it, trying to just find out a bit more about what Zika was. But certainly Ebola and coronaviruses, we do have sort of prior knowledge that they can cause big outbreaks. So I'm just looking at the $105 billion data set. We did have a category called behavioural and social sciences, which is a broad category. It includes health psychology, it includes attitudes and knowledge, it includes translation into policy and policy-related research, that sort of thing. Overall, in the whole data set, about 40% of it was spent on HIV research, with about sort of 6 or 7% each on tuberculosis and malaria-related research. I was actually slightly surprised to find that 5.3 billion, 5% of it was spent on behavioural and social sciences research. That's a greater component than I had thought would be the case. Within that, almost all of it was spent on HIV research. And actually, again, the vast majority of it generally of the behavioural and social sciences research came from the US NIH. They have funded quite a lot on well, some of the categories I mentioned, but sort of public health research and even a fair few trials on research in hard to reach groups, for example, looking at those injection drug users, prisoners, homeless, that sort of thing, as well as other aspects around sort of psychology and attitudes and knowledge to behaviour around infectious diseases. So there is a sort of portfolio there and evidence base out there. And within the sort of pandemic research, pandemic response research this year, so this is a separate data set. The link down the bottom left corner of the screen there links to our sort of online tracker. It's being updated this week and next week. So it's a few weeks out of date now, so that the amount will have gone up to probably about 4 billion, I reckon. But thus far, we tracked $3.3 billion US across just over 2,000 awards for COVID-19 research. It's already more funding than all tuberculosis, HIV and malaria research combined in 2017. So the overall research response has been massive, really. Most of it, about 2/3, has gone towards vaccine research, and that includes some of the sort of lump sum funding that's been awarded by US and UK governments towards vaccine research, which takes up the majority of it. There has been a focus on the behavioural and social sciences, I think. We reckon about 0.1 billion, which I think is about 4% or so of the overall database, 4%. But within that, it's about 700 or so awards focused in this particular area. So smaller awards compared to obviously the big lump sums for vaccine research. But again, the portfolio is there. And so that's as far as we've got with the pandemic analysis. There certainly is more that we could do in, for example, drilling down into those 734 awards to see within the sort of social sciences what areas are being covered and where the sort of the knowledge gaps particularly in there might be. But that's something we can do over the next 2 to 3 months or so. We're also looking elsewhere at funding flows for health research across 2020 more generally, and comparing them with funding flows in previous years. So to what extent has research into cancer and stroke and mental health and so on been stopped because of a focus on COVID research? Some initial findings on that study, we looked at the UK National Health Service, and we think about 7 out of 10 studies across all areas of health were in some way interrupted by the COVID-19 response. About 10% of those have stopped altogether, probably never to start again, and about 6 out of 10 paused recruitment or stopped their research for a period of time. And obviously, all of that will have a knock-on effect into those areas of health in terms of new knowledge coming out of that research. So COVID-19 obviously will have an effect on all areas of health generally, but that actually includes within the research environment as well. So I shall stop there. Acknowledgements to various sort of colleagues and co-authors down the years, and also the funders who've helped us out, provide us with this data. And also I should have actually added in their dimensions as well. This is where most of our database data comes from. That's a funding database that has allowed us free access to it, for which we're very grateful. My contact details on the right-hand side, but essentially I will stop there and hand back to Susan. Thank you very much.
Thank you, Michael. Very interesting. And your figure of 4%, even lower than the previous 5%, which is the one that's usually quoted, is very stark, given Jeremy's comments at the beginning, that while we wait for a vaccine, and even when we have a vaccine, actually, the BESI interventions are absolutely key to getting out of this pandemic, yet receive so little funding. And the need to be able to have really large consortia of researchers over different countries and contexts to be looking at the types of interventions that are going to be effective for different situations, that requires large amounts of money. And the idea of these 734 small projects does fill me with great gloom, because it just shows the sort of lack of scale and the lack of vision in terms of what's really needed to make progress here. So that's a very good introduction from three fantastic speakers, covering the ground really and setting the scene. For all of your thoughts who are on the end of this Zoom, unfortunately, we can only see the panelists, but we have our first question, which is from Marika Chameras. And Marika, are you able to unmute yourself, or Lucas, are you able to unmute Marika so that she can ask her question herself rather than me reading out, which would be second best.
Doing that right now.
Lovely, thank you.
Okay, can you hear me now?
Yes, we can, Marika. Welcome.
Fantastic. Hi, everyone. Good morning. This is Marika Chameras from the Star Center in Nairobi. Thanks again for a fantastic webinar. Really, they get better each time, really. I have a question which is maybe specifically to Marisa. And Marisa, this is really much appreciated to get a glimpse of this roadmap. What's really striking for me is that, of course, some of the points that are highlighted on there were kind of already part of the SDG proposed agenda. I mean, on data collection, on data keeping, on community resilience, etc. So I'm wondering whether you could elaborate on where you still see a shift due to COVID. Is it simply that you expect the sums of money behind this to be much larger, or do you see a shift in kind of nuanced reinterpretation of concepts? So, for example, the example that came to mind for me was that, you know, a year or two ago, community resilience would have always focused on the idea of violence prevention. Is community resilience now maybe becoming another word for better health systems or something? Where do you see the more nuanced shifts in this agenda?
Can I just jump in, Susan? Is that all right?
Absolutely, yeah. Please do. All the panelists, please feel free to jump in and you comment on each other, what each other have said too.
Absolutely, yeah, and I would love to hear the comments of my colleagues as well. So, Marika, thank you for that question. I think that's I think that's bang on. I think many of the points that we've made, as was mentioned, have already been highlighted in the SDGs. The vision is already there about what we'd like to accomplish, and now, of course, we're just sort of seeing it through the lens of COVID, a specific emergency. So I think your point about that it's sort of a nuanced shift is key here, and I think it's also around how do we do this from an implementation science perspective? We know what we want to achieve, but there's still a gap in much of the interdisciplinary cross-sectoral research on how to actually design and then implement the solutions with the lens towards resilience, sustainability, equity, these kinds of principles that have clearly been spotlighted through the COVID response and the pandemic. I think to Joao's point, I think there's also been a highlight, you know, this is unlike Zika, unlike Ebola, and I realize there were global health emergencies called, but this is really the first truly global pandemic that, at least in our lifetime, that we're dealing with. And I think it's really highlighted the need for how do we do those partnerships better? How do we ensure that we take a holistic view of the research funding landscape? and really sort of plug those gaps that aren't being plugged, but also to try to avoid duplication and redundancy, you know, globally, while keeping an eye on the differences in contexts across around the world. And I think another piece that, again, in principle, I think we know in the SDGs that have constantly highlighted, but we're now sort of seeing in actuality and in practice, is the interconnectedness of systems. So as much as the SDGs is sort of designed as this sort of a holistic approach, there's still been a siloed approach to sort of tackling specific SDGs. Even the way we talk about it, often, you know, you're talking about sort of the engineering perspectives, the environmental perspectives, the health. And I think one of the things that COVID has really accentuated is the interconnectedness of these different systems, and how can we break down some of these silos and both fund research and fund partnerships and networks such as Glopidar that really sort of bring these different approaches together. So I think there's a few things. I think there's the implementation. I think there's the how do we do partnerships better. I think there's the getting rid of silos and then I think there's that coordination aspect, that there's a responsibility, I think, of funders around the world to sort of do better. I hope that answered. If I didn't answer it, please let me know, but otherwise I'll hand over to my colleagues to chime in.
Thank you. Zhao.
So can I comment on these on the particular point of community resiliency that Marijke mentioned, and it's not the first time that we see historical these shifts of changing concepts to maintain talking about the same thing. And I think in part that is connected to our failure as BESI community to articulate what we do and what we offer. If we make a comparison with the vaccination or with the vaccine development world, it's extremely complex as well, right? No one is able to explain what exactly is a vaccine. And yet, from a policy perspective, there's a very clear goal of vaccine development. We have now X vaccines in development. And I think we struggle to articulate what we offer, and which means that given the lack of clarity, everything can be put into the same bag, and the expectations grow exponentially, and our capacity on delivering on those expectations are undermined. So I think there's work that we as a community need to do to articulate exactly what we do and what we offer in order to manage those expectations, and not to keep changing concepts, but always trying to say the same.
Thank you. We only have 8 minutes left, and we've got questions from Jeremy who'd like to come in and ask a question, and we've got a question for Janet Curran. So Lucas, while Jeremy's asking his question, could you mute Marijke and unmute Janet? And maybe we'll take the two questions together so that all the panelists have a chance to respond at the end. Jeremy.
Thanks, Susan. Fabulous talks from people. Thank you so much. Very rich overview. I was actually going to follow up, and I think both Marissa and Zhao mentioned this in their responses, which was about, you know, we need to have different groups of researchers coming together who've not traditionally worked together to address this, you know, these problems in an interdisciplinary way. I was going to ask, what can funders do to encourage that? But also, perhaps more pointedly, as we're in BESI trying to develop a global community, do you have advice for us about what you think we could do that might help advance the kind of issues that both Marissa and Zhao mentioned?
Thank you, Jeremy. And Janet, can you ask your question now, and then the speakers can deal with both questions at once? Janet.
Yes, thank you. Good morning. And thank you for these very interesting presentations and very important presentations to inform the global community about what has been, what is currently underway in terms of facilitating research on this important topic. My question is related to, I think you've touched on some of it, Marissa and Zhao, in terms of how we can, as a global community, facilitate rapidly replication research so that we can build knowledge in important areas in relation to social and behavioral interventions. So that was my question in terms of as projects get funded, how can we quickly facilitate or share the summaries of these so that they can be replicated elsewhere?
Great question. Thank you, Janet. Okay, let's go in reverse order for responses. So Michael, and then Zhao, and then Marisa.
Thank you. I think in terms of promoting the multi-country collaborations, and to touch on a little bit on the previous comments around SDGs, within our data set, we found that about 10% of the overall funding had a focus on lower middle income countries, and the rest of it was taking place in and or had a focus on high income countries. So I think we need to do a lot more in terms of promoting collaborations with colleagues in resource poor settings, and also allowing them and encouraging them to lead the research so that the findings are much more likely to be taken up into policy and practice. It's all very well us in the UK or US or Canada, wherever, doing research in, for example, Ghana, where I've got some research going on, and then running away at the end of it, and the locals are wondering, right, what happened there then? If they are leading it, then those findings are more likely to be impactful. And that also includes, actually, from a funder's point of view, having application forms that are not horrendously complicated. And I'm thinking about GES and the UKRI system, which is just hideous. I have had many a difficult conversation with colleagues anywhere in the world, but including those who are not used to filling out research forms, and how to fill out the GES system and the NIHR system as well. To the extent that I've basically taken their login details and logged them myself and done it, just because that's easier rather than having to explain it to them. So I think making research accessible to low middle income countries with them as the lead partner and Southampton or UCL or wherever as collaborators, that can be a point that funders can lead the charge on, in terms of having a big enough impact to help support their SDG targets, I would say. Thank you.
Thanks, Michael. Zhao, you need to unmute.
So many months of Zoom and still muting myself. I think one of the mechanisms to address the problem of bringing people together, and by people I mean different epistemic communities, but also individuals spread around the world, is to bring issues of diversity and inclusion that are so much involved in terms of organizational management into the management of research, global research communities. And funders, and in that case, it tends to be funders, organizing meetings, setting agendas, and so on, being committed to those principles. And when organizing a meeting, the chair should not be the same old people that always chair meetings for the past 10, 15 years. But again, that comes with costs, and costs of time, not costs of money, of efforts to know research communities outside our immediate garden. So I would bring those issues of diversity inclusion to the center of managing portfolios and developing portfolios.
Great, Zhao, very important. Thank you. And Marisa.
Thank you. And I'll just build on, I'm not going to repeat, I think, the excellent comments that my colleagues made. So I completely agree with Michael and Joao. So I guess maybe the only two additional pieces I would mention is these partnerships and these networks that are so critical. We really have it's really important to think of them as part of the preparedness, which is perhaps another shift of the way we're looking at it, that preparedness also involves having these networks in place, because we've seen how long it can take to create networks, to create partnerships, and in an emergency, it's just not feasible. It's not possible. And then I think the final piece that I would just add to the great comments is this participatory process. So what we undertook with the UN report was also a little bit, it was actually experimental from a process perspective, not just the sort of end result of questions. It's sort of like, can we engage rapidly with global partners, including other funders, but also implementers around the world, in the global south, in the north, and as well as decision makers and researchers, and try to sort of prioritize critical questions that we need knowledge to be generated. So and we need more of those kind of experimental processes developed, and I'm not saying what we did was perfect. I think it's more about learning how do we do this rapidly and in a very participatory way. And I'll stop. I know we're running out of time. Thank you.
Thank you. And thank you, all three of you, for joining us today. Just been a tremendous discussion, really rich and incredibly helpful. As we said, there were problems with many people getting onto this webinar, but it will be put on our BSEE website, and we will make sure that we tweet it, we put it on our JISC list, and we disseminate it. Just to finish, Jeremy, can I hand over to you for some final comments and also to put up the slide of our next webinars, if that's not too technologically challenging.
Yes, just
while we
me a
wait,
second.
can I urge everybody who's joined us today to follow us on Twitter and also to join the JISC Mail list, which isn't overburdening, but has some very useful information on it.
So
And
can I just
are you
check,
able
Susan?
to, yeah, can you put it onto the full slide just so it's a little bit bigger?
I can, just give me a second. And then I'm going to have to do this. Sorry, I should have had this already, shouldn't I?
Brilliant.
Okay,
Great.
so thank you so much. I really found that incredibly helpful. So really sort of an amazing sort of session. Thank you to Marissa Zhao and Michael. The next webinar is going to be on Tuesday, the 10th of November. It's 11 to 12 p.m. GMT, and that's going to focus on engineering approaches to COVID. You know, we've talked a lot about behavioral and social interventions, but also as we understand more about transmission routes of the virus, it raises sort of issues in terms of can we physically engineer the environment better to reduce the risk of transmission. So really looking forward to that, and looking forward to the seminars after that. So please keep these in your diary and join us, and we look forward to your contributions then. Thank you very much.
Thanks all, and hope to see you next time. Bye.